So we might formally get started. So I am Professor Ian Hickey. I'm the Co-Director of Health and Policy at the Brain and Mind Centre at the University of Sydney, and I'm one of the Chief Investigators on an NHMRC Centre of Research Excellence on preventing youth suicide, along with my colleagues from Origin Youth Health and elsewhere, and particularly Professor Joe Robinson and the Origin team on suicide prevention, who lead this work. And this webinar is part of a series of Flatten the Mental Health Curve. As we all know, we live in challenging times in the COVID-19 era. We were pretty worked up about this issue before COVID-19 came along. Now we're really concerned, as many of the most adverse impacts of employment, education and social disruption are actually on young people in our society. I'd like to start by acknowledging the traditional owners of the lands, on all of the lands on which we meet, the University of Sydney. It's the Gadigal people of the Eora Nation. And in much of my work over many years, unfortunately, we've never adopted really the fundamental insight of the traditional owners of this land. It's about all of our social and emotional well-being in the context in which we live on an ongoing basis. I'd like to also recognise the lived experiences of those who have had mental ill health themselves, their families, their carers, and the difficult experiences that they have often had. At this point, I'd like to now formally hand over to Professor Joe Robinson to introduce tonight's fascinating webinar with the Young and the Restless.
Thanks, Ian, and hi, everybody. I would like to add my acknowledgement of the traditional owners of the land that we're meeting on here this evening. We're in Melbourne and the land of the Wurundjeri people of the Kulin Nation, and I would like to pay my respects to their elders past, present and emerging, and to acknowledge the lived experience of people who have experienced suicide in whatever shape or size that is, and very much acknowledge the experience of the young people that we have here this evening, and really kind of commend their kind of courage and willingness to share their experience with us in helping move this area of work forward. I think lived experience can mean lots of different things in suicide prevention. For some young people, it might mean surviving a suicide attempt. For some, living with constant suicidal thoughts or supporting a suicidal friend. And tragically for some, it also can mean losing someone special to suicide. But all of those experiences are valid, and they all can help how we shape the future, or how we might start to do things differently in suicide prevention. But I think, and I've been around the suicide prevention sector for a very long time, and you know, the sector has, in Australia, we've done a great job of engaging and listening to the voices of people with lived experience. But those voices are, for the most part, adult voices. And young people don't often get a seat at the table. And that really is what tonight is all about. There is a lot of attention that's being given to suicide prevention in young people, including public spending and advocacy, particularly from, you know, people like Ian and myself. But for several years now, suicide rates have been going up amongst young people, which tells us that we need to be doing something differently. And I think one of those things that we need to be doing differently is listening to what young people think the solutions are. So without any further ado, I will practice what I preach and hand the microphone over to our hosts for the evening, Zoe Tay, who works with me at Origin, and Sam Hockey, who works at the Brain and Mind Centre in Sydney. Over to you.
Hello. Hi, everyone.
Hi,
I'm Zoe.
I'm Samuel.
Yes, so I am a 26-year-old research assistant with Joe at Origin, and I'm also studying my master's at Deakin.
And like Joe said, I am I hope she didn't say my age, but I'm 25. And I am a lived experience and youth researcher at Brain and Mind Centre. So super, super keen for tonight's conversation.
So to start off, we're just going to go around the virtual room and introduce ourselves. Can we start with Taylor?
Hey, so I'm Taylor. I'm a 22-year-old osteo student from Melbourne. I'm originally from country Victoria, and so far I've used my experience of suicidality to sort of advocate and work with organisations such as Origin, Movember, and currently I'm working with Youth Live for Life as a director on their board.
Thanks, Taylor. Next up on my screen, I have Annie.
Hi, I'm Annie. I am a 23-year-old law and communications student at UTS in Sydney. I am also majoring in policy, so the sort of this webinar and the content and discussing that side of it is really interesting to me. And I also work as a speaker for Batia, which is a preventative mental health non-profit.
And next up, we've got Alex.
Hi, I'm Alex. I'm a 17-year-old high school student, and I am a mental health and LGBTQ+ rights activist, and I work with a lot of different organisations such as Origin and my local council in Wyndham.
And last but not least, Finn.
G'day, I'm Finn, I'm 19 and I study communication at RMIT. I have a mad passion for mental health advocacy, probably because I'm a little bit mad myself. I'm keen as a bean for today's discussion because I think mental health is one of the world's most important public health issues ever. And thank you to the Origin organisation for providing us with this platform. It's an awesome opportunity. And hello, Mum and Dad, I love ya.
I love that so much. Thank you so much, everyone. I'd like to just give a great reminder of the Q&A function down the bottom of your screen that you're able to use. You're able to type in questions, and Ian and Joe and myself and Zoe and all of our panelists will be helping to answer your questions either in our conversation or via the message board. I'd love to jump straight into it. We want to know, I mean, the whole reason we're here tonight is to know about young people's experience in help seeking and how the youth of today experience mental health and its services. So Taylor, could I call upon you to answer perhaps a question around what do services, what services do work rather, and where could some services be improved?
Yeah, so for me, I think it's not really just the services. It really depends on who you go and see. And there's sometimes you can go and see a GP and they're amazing, and sometimes it's not that great. But for me, I think there's a real big issue where it comes to actually just going through and getting the mental health plan through a GP and then actually going on to get the sessions. It's so hard to find affordable or like actually covered psychology sessions when you can actually access it within maybe 2 or 3 months. So often as a young person, we've got to wait, that time. Or for myself, I've had to go over to the other side of the city of Melbourne just to find someone that is under $50 on top of the Medicare rebate. And I don't have to wait 3 months. So I think that system's sort of really tricky, and it sort of leaves a lot of young people in a vulnerable space where they can't actually pay for services and they can't actually access services. And I think it's really tricky, and we really need to address that.
Yeah, like you're so right, Taylor. Like with access to care, it can be really difficult and challenging. But, you know, because young people are a very diverse group of people, we're all different. We're all, you know, coming from different backgrounds, and not all of us have the same experience. Now, Alex, you and I had a chat before about how your experience as a trans and gender diverse young person was also very different. Do you think you can talk a little bit more about, like how help seeking or what kind of barriers that you experienced when you were, you know, trying to navigate the system yourself?
Yeah, I think my lived experience is slightly different in the sense that my mental health was very directly tied to where I was at physically. And acknowledging that and realizing that at the beginning was something very difficult. So I had like virtually no idea why I was feeling the way that I was feeling and why I was feeling so sad all of the time when I was like 11. And you shouldn't really be feeling that way at 11. So accessing services at that age, I had to lobby to access them with my parents first. And then once I finally got places, there was waiting lists, and as well as getting medical treatment, it was really difficult. I had 3 different counsellors within 2.5 years at the same service. I felt like I was just repeating my story over and over again rather than actually getting anywhere or receiving any treatment for anything, because I just had to come in and say the same thing that I'd said last time. And with that service, the wait time, the time between appointments was very few and far in between, anywhere from 3 to 6 months. So you're kind of catching up on what's happened in those 3 to 6 months rather than actually getting anywhere and progressing. So I think that's definitely and with that, I think it came from the fact that there's just not enough funding or staff or people in place to actually have up to date and concurrent appointments in a reasonable time frame. So I think that's definitely something that needs to be looked at and addressed.
So I want to throw a question to every one of our panelists. We've had a question come through the Q&A section, and don't forget to use that. What could be some practical solutions to the waitlist problem that young people are experiencing in today's services? Finn?
Okay. I think if we were to lower the prices, I think the cost is actually a huge barrier for a lot of people. And I think education is extremely important. I think emotional intelligence should be taught in schools. And I know it already is, but it needs to be strengthened. It needs to be more engaging, I personally think. Because we had in my school, I'm from Sunbury, which is about 20-minute drive from Melbourne. We had pastoral care in year 8 and year 7. And it was just, no offense to them, but I remember it was such a drag from my experience. And I don't know, I personally think a lot of people can resonate with that. So if there was a kind of improvement in the education department and perhaps the media, if the messaging was more positive as opposed to negative, it would just be so much more helpful for children everywhere and adolescents.
Yeah, completely. And I think that one of the big things is about that understanding as well, and that meeting the individual where they're at. I'd love to know a bit more from you, Alex. What was it like when you actually received the right service and the service that was tailored to you, that was meeting your needs when you presented them, I guess?
Headspace was great. Once I finally got through the waiting list, I think I had care there for about a year, and that was just on a basic mental health care plan. And my sessions, probably wasn't a year actually, because I only had the 10 sessions, but they were amazing. I just felt really comfortable in that space and understood. And I've been to a few different counsellors there in different times, because I've been in and out of counselling over the years, but every single time I've been to Headspace, it's just been great. Yeah.
So we've got another question from our lovely audience. Someone asked, what are your experiences of using crisis support helplines? And maybe we could start with you, Taylor, because I remember you and I had a chat a few days ago now, about crisis access points. What are your experiences here?
I think with crisis access points, it's really, really tricky. I know myself and a couple of my friends, my partner and my brother have all used different online call services, and I found them to be really sort of struggling and not really at what I needed at that time. I was in a really suicidal mindset, and I didn't understand what that was. And the person on the other end of the phone just wasn't able to give me what I needed, I suppose. And it feels really hard because it doesn't really feel like there's many crisis points. So if I'm having a suicidal episode at the time, or I'm going through a week where I'm feeling suicidal, it might be, as I was saying earlier, so long before I can actually go get help. So I think we really need to figure out how we can find better ways for like having more and free crisis access points. And I think that's what Zoe and I sort of had that earlier.
That's awesome. Taylor, I'd love to ask you one other question. And then I've got a question for Annie. Around schools and the support of mental health and well-being, what could schools be doing differently?
I think, like, I honestly think there's a lot that needs to be done around long-term education on mental health and mental illness and suicide. We go to a lot of schools, and I know myself personally, we had health classes from year 7 up to year 10, and it was never really touched on about what to do or how to help out friends and stuff like that. And I think it's got to be done in schools. It's got to be addressed, and it's got to be done in a way where it's not just a one-off session. Like, as good as they can be in opening conversations, that's not the ideal way in my eyes to have long-term benefits to young people where they're mentally capable, or they're capable of understanding their mental well-being and helping out themselves and their friends.
Completely right. I want to ask Annie, we've had a number of questions around what does good services for youth mental health look like? What do they sound like? What do they feel like? Do you have any opinion? Well, I know you have opinions on that, but would you like to care to share them?
Yeah, I would definitely. I think on this, what we were just talking about in terms of crisis points and crisis helplines, I think it's important to kind of acknowledge the fact that they are exactly for that, people that are in crisis in that moment. And so they don't have the capacity or ability to provide continuity of care or ongoing support for people that have perhaps more complex issues that they need to sort of unpack. So I'll say that about that. And in terms of schools, I really think that early intervention is so important. So there are organisations like Batia, whom I work with, who go and present in these sort of spaces like schools and universities and talk to students. And I think what's good about that is that they often have another young person who's kind of their peer, imparting their lived experience, which is, just to be honest, a really effective way of getting young people to listen. So I think that's important. But what Taylor said before about it not being just like a one-off, program that you hear one day in year 11, I think that, what was I going to say? Oh yes, I think that an overhaul of the curriculum, can I be so bold as to propose that, in terms of PDHBE, that is, sorry. Yeah, including sort of mental health awareness or a module or assignments or whatever the hell it is. Yeah, making that a part of PDHPE, which is, I believe, compulsory for all students up until the end of year 10. So, yeah.
Forgot to unmute myself. I wanted to ask a question around advocacy and what does, almost continuing what you were saying, Annie, around safe communication about suicide prevention and what that looks like. I might throw it again to you, Annie. What does lived experience look and feel like for young people, and how can that change, I guess? For like change the mental health services, I should specify.
I think this is such a complex question, and it will definitely depend on the individual, what safe advocacy sort of looks like for them. But I will say that it doesn't look like silence. It looks like ongoing conversation. And I think advocacy is obviously about change, and in the context of mental health and suicide prevention, it's about changing not only the structural barriers, which we've just sort of spoken about, the services, but also cultural barriers. So people's attitudes and sort of awareness and how mental ill health is perceived. So people can do that on a number of levels. And I'll talk about quickly about Batia, which again, which is a way that I'm able to share sort of my voice and educate people, but at the same time also empower myself. So I think that's really valuable. And in doing so, I definitely adhere to kind of guidelines in terms of safe sharing, so that you can communicate your story effectively, but also not in a way that's going to trigger people or alienate people at all. So yeah, there's definitely ways to advocate most effectively, and there's ways to do that across a lot of different spheres.
I also just have something to add to that. I think I genuinely think people want to hear the truth. They want honesty, and they don't want to sugarcoat, you know, like just saying something like, you don't want to offend people, but at the same time, like we have to understand how different everybody is, and everyone's affected by things differently. So when people feel like they're not given the truth, they become extremely frustrated, and then they don't seek the help because from frustration comes apathy, and from apathy comes inaction. So I think we really have to it's in the media, in education, in all of the departments, we just have to tell people the truth as much as we can, and from there progress can come, you know.
Alex, you wanted to answer one of the questions from the Q&A. Did you want to take over?
Yeah, someone just asked about what our thoughts are on prevention work in primary schools. And I think when done in the correct way, it would be really, really useful. I started experiencing mental health when I was in 5th grade. So I didn't really have much access to services or know about services until I ended up going to high school. I ended up accessing private counselling and therapy because we just didn't know about the services that were available until I started going to high school. And I was like, oh, I can get a mental health care plan, and oh, I can go to Headspace and access their services. So I think even just letting kids know at a younger age that if you don't feel right, or you aren't feeling the way they used to, or explaining things in a really nice way that makes sense, I think it's really useful just to put the information out there and go, this is available to you. Because Headspace, again, for example, is 12 to 25. So that's grade 5 onwards. And I think education from a younger age is really important to try and carry those skills through.
I mean, that's what we're doing tonight. We're holding a webinar from Young Voices about young experiences, trying to educate and inform the services that we do access in real time. Taylor, I want to ask you a little bit about what advocacy looks like. Annie touched on it with her work with Batir, and about that suicide prevention is that there is no silence. What extra do you have to add to that?
I think advocacy for it to be really effective, the young person's really got to be supported in it. And it's where we're able to have our voice, and have a voice that's our own, and not a voice that suits the people that are around us. Because there's so many times where I've been at a table where I'm the only person under 40 or the only person under 50. And that's a scary time. And especially when I started this around 18, 19 years old, like I didn't know what to do. Everyone was in a suit or and it's scary. And I think it's really important that the young person is supported when they're going into those, and they're not the only young person in the room, because when you've got that person with you, or someone even that's on your side really, and saying like, it's okay, say what you think, like, I think it's really positive, and it really helps with advocacy, because without, I suppose, having that support, and it's just one versus the room. I know everyone's like trying to be there to support. I think it's not really true advocacy.
Sorry, I was just enveloped in that answer.
Sorry, I rambled a bit there.
No, not at all. We have a question from the panel, to the panel, around how can a family or a carer be involved in the mental health treatment, including, you know, whether it's family therapy, whether it's more individual based. How do you guys see that working, Finn?
I think just listen, like just really show, like explain to people that you're willing to listen and not judge them. I know a lot of people that are scared or have a fear of judgment, myself included. So the last thing anybody needs is judgment. So just sit there with your ears wide open, your brain wide open, and just try your best to understand them and what's going on in their life. Because you don't know. You never know.
Alex, you had something?
Yeah, I think with that, listening is great and offering the services is great, but I think something that needs to happen first is bridging that intergenerational gap when it comes to counselling and therapy. Because for my parents, for example, like it took them a long time for them to come to terms with the fact that I needed it, and I had to educate them on why I needed it without being able to fully explain what was wrong with me because I had no idea. And I think just having, like, trying to get them to actually come to a counselling session would be practically insurmountable at this point. And I don't think that's a fault of their own. I think that's just something that they've grown up with and gone, oh, I'll just lock it in a box and I don't need to talk about it and it's fine. And we just won't touch it. But that's definitely something that we need to address first before we can go, oh yeah, let's go to a family counselling session.
Completely. Yeah. I absolutely love my family, and they have been an absolute rock, but it is such a hard relationship to navigate when you're trying to navigate what's going on for you emotionally, mentally, and physically sometimes, particularly in adolescent years. Annie, I'd love to know your thoughts on international advocacy and peer support.
On international advocacy?
Yeah.
Gosh, I would be lying if I said that I am super across the different kind of approaches around the world. Although I know sort of Australia's kind of system and perhaps access issues really well, I think that it's so many different places approach things in really different ways. I think, and like a lot of the time, access to services depends on the sort of the government in your country, or even a whole lot of things. I'm trying to think what I have to say on this. I think that there is the sort of potential to utilize technology and online services, which is something that I see as being the definition of global and international. So I think that's kind of an interesting idea to explore. But in terms of international approaches, I am not that clued in, I'm afraid.
That's totally cool. I mean, national is just amazing, which is what you're doing tonight. So I'd love to ask the panel a question that's come through the Q&A feed. How can we prevent young people who have faced adversities and don't have supported carers or parents or a network around them from slipping through the cracks? Did you want to answer or start that off, Taylor?
Yeah, I can try. I think it's just making sure that there's heaps of like services, heaps of images, heaps of messages around everywhere that we can. I think I'll pass on to Finn because he's got a bit more prepared on this, but I think just having as many things as possible to cater for as many avenues is really pivotal.
Thanks, Taylor. I think I would personally say that identifying the stigma is the first step. We have to acknowledge what is the stigma. Like, coming from a town like Sunbury, there are a lot of people who don't know what the stigma is for mental health. And I would think, honestly, it's as simple as anybody judging anybody else is the mental health stigma. And that is a very broad thing to say, and it's very complex because people are allowed to have opinions and they're allowed to judge things, but it comes at the price of people's feelings. And I think Maya Angelou said, people will forget what you said, they'll forget what you did, but they'll never forget how you made them feel. And as much as we constantly I know it can get tiring and repetitive, but we just have to really try to empathize with people. It's always empathy that it comes down to the bottom line of. So I think visual kind of material in media and education could be effective on an international level too, because there's like visual is the international language. And just basic tolerance of how different everyone is. No one's the same at all. Sorry.
And I think Alex wanted to jump in there as well.
I do. This is probably more for students and I mean possibly uni students as well. But I think to prevent young people from slipping through the cracks, schools are a great way to avoid that. A lot of the times, if you're not having the best home life or don't really have supportive carers or parents, then school is sort of your escape. And to navigate around that, school counsellors are a great resource when they're correctly sort of advertised within the school system. I mean, like, they're great, honestly, for sort of if you can't stay after school or get to service without transport, or you might be blocked in some way, schools.
Yeah, you're right. Like for me, my school from memory didn't really have much about mental health. We didn't even talk about it. And I remember we had this one room, like the school counselor room, and it was like tucked away in like some dark, dingy part of the school. And it was like the scariest place to walk into. And so no one would even dare to like just go there, you know. It was always really weird. Finn, so you access services at university. How do you think universities could reach out to students who are struggling, or who, you know, as like an early intervention or as a way to bridge them to services?
Well, I initially reached out for services when I was in school. There was counselling at my school, but it didn't gel. It was relatively I was explaining things and I just didn't really get the response at the time I felt I needed. So when I was at university age, I sought my own assistance, and I went to a sex therapy clinic. I went to my own psychologist in Sunbury, and I know that RMIT, my university, does provide their own counselling services too, but I didn't go to them. I just went on my own accord. But I think as long as we're just getting the message out there that like it's not weak to speak. We just have to constantly remind each other that and post it all over our social media and that type of activity. Yeah.
I love that, like, it's not too weak to speak message. And yeah, even talking about things, because we're here all together today to try and battle the stigma, as we mentioned before. I'm just going to throw this question out to the floor about stigma, and, you know, how do you think we can change that? Like, how do we think we can address the stigma, call it out, and slowly, you know, break down the barriers that are preventing a lot of young people like yourselves from seeking help?
I think humility. I think if we recognize that sometimes we've been toxic, everybody's capable of toxicity, myself included. So as long as we're able to identify where we went wrong and potentially apologize if it calls for it, on the macro scale, I'd say I'll handball it to someone else. I can't think of a proper answer.
I was going to say, on the macro scale, if there was a lot of voices from really prominent people in society around, whether they're celebrities, whether they're sports people, whether like politicians, doesn't matter, whether they sort of like stood up, had a bit of that advocacy as well, and talk about their experiences, or talk about that it's okay to not be okay. I've gone to see psychologists. I've done all these things. I think that can be really beneficial to young people, because a lot of us look up to, I know, especially when I was in high school, you look up to those type of people, and they can have a really big influence on who you are and what you do, and like whether you seek help or not, because yeah,
because it normalizes it.
exactly.
Yeah.
Annie, I'd love to know your thoughts on stigma versus discrimination in what we face as young people experiencing mental ill health, and we've talked about stigma, or touched on stigma a fair bit this evening, but I'd love to know, have you experienced one or the other, or what is the difference between stigma around mental ill health and discrimination around mental ill health?
Really interesting. And I think the two are kind of, you can't really separate the two, to be honest. I think the idea of internalized shame or an internalized stigma is really interesting. I definitely know that I have encountered that myself. I mean, discrimination is really treating someone differently, like differently to how you would treat them if it weren't for that element or factor or whatever it is. And we certainly do that with people that are struggling in any way, that aren't sort of thriving and succeeding and whatnot. So I think that, yeah, discrimination is rife in terms of how, in terms of our societal sort of conception of mental health and suicidality, and changing that, it's so difficult. But I think we need to start with the different contexts that we have. So in the workplace, what can we do there, or in the academic context and uni, and what kind of measures might be appropriate there to introduce to make sure that we actively, perhaps even actively prevent people from being able to discriminate against those that are mentally ill. The same way that we're not, you know, it's the same way that you can't discriminate against people on the basis of race, religion, etc. So, yeah.
I think we also need to normalize change at some level. If COVID's taught us anything, it's that people struggle with change. And I just, like, change is healthy. It is healthy to be in one spot and then be in another, the next, go back to that spot, go to 2 spots ahead one more time, you know? Like, we have to just really comprehend that you're okay doing what you're doing. There's no one that is expecting you to do anything but you. It is all up to you. And then that applies to everybody. So.
Absolutely. I'd love to know, Alex, from your position as a young trans individual and sort of, I guess, connected to the LGBTQ community, why is tokenistic representation a problem?
Yeah, that's a good one. I think tokenistic representation it doesn't have the same effect, and you know that it doesn't have the same effect. And that's, I think, the main part of it, is that everyone that sees it sort of knows. We're like, oh, yeah, you don't, like, you can be there as much as you're there, but really it doesn't mean anything. And I think that's sort of the whole premise of why it's tokenistic. Like, it's like a placeholder for, yes, I'm here, but not really.
And I guess this is a question to everyone on the panel. How do you think we can avoid that? What can we do better?
Is tokenistic when, is that when, like, someone is singled out?
Sorry, so tokenism, it's kind of like you have this one young person come up and, you know, they're asked to do like this whole spiel about something, and then they sit down and nothing happens after that. Like, they're kind of used as a token to represent a whole issue, but then their voices aren't really being heard, and they're kind of repeating their story over and over again for the benefit of others, but then, you know, it doesn't really work, and they're not actually, you know, being actively engaged or partnered up, and they're kind of used as like the idol, like the token, if that makes sense, Finn.
Yeah.
I think on that, make sure the young person knows what their voice has changed. So like, if I've given an opinion on this, are you going to make a change because of it? Or are you just not going to do anything and you're going to like, sounds good, we think about it. I think when it's not tokenistic, you're telling me how you're going to make a change and how you're going to make things better because of the voice that we shared.
Can I jump in on that too? Yeah, no, maybe.
For sure.
Yeah, I think that the opposite to tokenistic is what we should be focusing on, as we all sort of agree, I'm sure, which is sincere representation, acknowledging the complexities and nuances of all people and everyone's diverse needs. That's not to say to dismiss people that have particularly, sorry, that's not to say, I just realized how that came across. Everyone has diverse needs, but we need to make sure that all of those diverse needs and all kinds of people and all kinds of stories are represented, heard, listened to, etc. So that's hard and that's really messy, and it's really difficult to do because it involves a lot of work, and it's not sort of putting forward this nice, neat story of recovery or whatever. So I acknowledge that it's tricky, but it's important, because if young people don't see the diversity like represented, then they're not going to be able to relate or feel like they will be heard when they do sort of go and seek help.
And I think also add humor to it. I think at some level it's like if we show others that we can laugh at ourselves, they will laugh with us laughing at ourselves and then they'll laugh at themselves. So I think if we add some wackiness and kind of thinking outside of the boxness to whatever angles we decide to take, that is another helpful avenue.
Absolutely. I'd love to ask a question that's come from the Q&As. This individual is keen to hear more about what can GPs and GP practices and their whole sort of setting environment do to lessen the impact. Sorry, my clock's going off in the background. That's terrible. To lessen the impact of psychological distress whilst a young person's in a crisis. What can, from an environmental point of view, what can GPs and their practices do? Did you have anything to say on that, Finn?
I think we could extend the, is it the mental health plan? I think if that was extended to 20 instead of 10, I think that would be a really helpful reform. I understand there's a lot of intricacies and it sounds probably naive of me to say we should just do that, but that's all I can think of off the top of my head.
That's fine. Annie, did you have anything to say to that?
Yeah, I do. Without wanting to tell GPs how to do their job, we hear this idea, which I agree with, which is in the kind of wider conversation about GP capacity building, and I think that would be valuable. So often people's first point of call is their GP. And if that initial interaction is not kind of fruitful and encouraging and things, it can and does really deter people from seeking help. So there's that. Totally agree with Finn about increasing the number of visits that are Medicare rebatable, I think is the right expression. Obviously, that's more of a kind of a policy move. But also in terms of GPs, I think that it would be really useful for them to know what kind of services might be available to that young person in, say, that particular geographical area, or for those, or for certain kind of needs. So that might be like having really carefully on hand the different kind of psychiatrists or specialists or people that may be able to assist in that moment, or having a little card where they've got helpline numbers and things, or just sort of really pointing them in the direction instead of just filling out the paperwork. I think that would be valuable.
I think GPs can, make a really big impact, and considering they're the gatekeepers, I think it's really important to focus there. We've had a question from the audience about how, as young people, what can we do to help create a culture where we look out and safely support one another who are, you know, experiencing either mental ill health or suicidal thoughts. And I guess, yeah, we are living through this. It's not like a lived experience, you know, it's not past tense. It's something that's continuous, something that's evolving over and over again in real time. So what do you guys think about how we can, you know, foster that culture? Can we do this online, like on social media, or can we do this in schools, in universities? Does anybody want to jump in that one?
Oh, sorry.
Sorry.
No, Alex can go.
Or Alex, you guys go.
Oh, Annabelle.
Yeah, you go.
What are we doing?
Alex can go first, and
Okay.
then Finn, and then Annie.
Now the questions that are made. Hold on. Annie, go.
What was it? How can we change the culture? And
How can we foster like a nice, safe, judgment-free culture where young people can support one another? And I guess where, like online or in universities?
yeah, I think it has to be in all contexts. We're dealing with an entrenched stigma. And so that means it's got to be across the board. So, you know, in your classroom, when you're having lunch with your friends, just any context, we need to be talking about it. There's this really beautiful quote by, I want to say, Brené Brown, and she says that shame can't survive being talked about. And I think that shame and stigma are super synonymous, and that's the truth. The more people that we talk, or even if it's, you know, speaking about it to a couple of people in your family, it's a kind of ripple effect, or it's going to be a ripple effect, hopefully. So yeah, those are my thoughts on how to kind of foster a more accepting culture environment.
Yeah, it's all about communication. I had something I was going to say and it's dwindled a bit, but communication is everything.
How can we communicate better? Sorry, Alex.
Don't worry about it. I think we've covered it all, but I will expand on how we can communicate better. I think like little things, just knowing that you're open to a conversation about mental health or suicide by like putting a post on social media about something, or a chat safe campaign, for example, because then people know, you know, you're supportive, you know what's going on, you're open to a conversation. It doesn't have to be like plastered in black and white, here I am to have a chat. It just like giving little cues for people to know that you're open. And the same thing can happen with schools through things like the Are You OK Day campaigns and other mental health stuff that happens all through October, really. I mean, there's plenty of things all throughout the year that schools can do and unis can do to promote that sort of culture. And I think taking advantage of those is one of the greatest things that we can do to help foster that.
Amazing. I think that's so true. It is about fostering and nurturing that ability. We have enough time for 2 more questions, and both have come from the Q&A section. One individual wants to know, as a worker within the mental health profession, what 3 qualities or behaviours can they themselves show to better support young people at risk, which I think is brilliant. Can I ask you, Taylor, first?
I think I would just say listen is the biggest behavior. So if we're talking, this has probably taken, I don't know, days or hours of thought to decide that we want to open up to you. So try not to cut us off. I think another one would be just be open as well. Just talk about things like, oh, if you don't want to talk to me, it's okay. Like there's other people as well. And sometimes a young person, like I might talk to my partner about something because I don't want to talk to my psych about it, or I might switch it up. Like just be open to being multiple, like it might not be you as well. And I think behavior is just like really, I've always like found that I'm better able to communicate if someone's really open or really gentle to me. I'm not someone that's really, I'm not really good with conflict. So if someone's really open and let me speak as much as I can or feel comfortable, I think that's really beneficial.
Agreed.
I agree with it. I'm sorry. I think like being candid is such a likable trait. Like, when like even with the topic of death, like there are taboos that are very difficult to talk about for varieties of reasons because people could be sensitive to them. We have to understand the sensitivities, but I think we also need to expand on just the delivery of the conversations, because like death, for example, is something that it happens to everybody, and it's okay. Like we just have to accept it one day or today. So and or yeah.
How about you, Annie? What 3 values, traits, behaviors, qualities that a mental health worker can embody to better support young people?
I think I would first of all say being empathetic is probably the main one, and that obviously is hard, and it also encompasses a whole lot of other qualities. But what that means to me is that someone is listening, someone's listening closely, even if they haven't had that experience, they can relate to the kind of feelings and everything that experience may be having on you or causing you to feel. So yeah, I think that's really important, and makes people feel listened to and heard, and want to continue sort of sharing and opening up about things. I would also say patience is really important in the clinical setting, because it can take a while for people to come out of their shell, to sort of come to terms with different things that they're experiencing, and and the kind of pressure or expectation on people to kind of get better quickly is really damaging, and that's also just wider than in the clinical setting too. And I would also say, particularly for mental health workers, but also for the lay person, not being judgmental. So yeah, non-judgmentalness, non-judgmental. I'm not sure.
Judge free.
Judge free. Whoever knows. I think you guys, you'll understand what I'm trying to say. But I have had friends and things that have refrained from confiding something in their psychologist or whatever due to fear of judgment. And while that's not good for a whole lot of reasons, it can also be dangerous, because it might be some kind of really reckless thing that they're doing or whatever it is. But fear of judgment is also really harmful. So yeah.
Yeah, I think that's really insightful. Alex, I want to ask a similar question, and then this question will go around the panel and we'll ask everyone. What has been the greatest positive difference for you in your experience with mental health?
Mine isn't necessarily mental health related, but one of the biggest experiences in a mental health space that stood out to me was when I went down to the reception at Headspace and said, I'd like to change my name and pronouns. And they did it absolutely just off the bat, because I've had a lot of issues with my school, and my school counselor refused to use my name and pronouns in session. And I definitely did not ever want to go to counseling just because of that. I felt I was disengaged when that started happening. I was like, this just isn't for me. So when that went straight through with Headspace, I was like, oh, this is great. And they're understanding, and I feel safe here.
That's so good. Finn, what has been a positive difference, or the greatest positive difference, in your mental health journey?
I'm blessed to have a very supportive family, which is why I said hi to mum and dad in the beginning. I've got a fantastic family, so I'm very grateful for that. Also, I just think at some level, my nature is very independent, so I knew that something was going wrong in my body, and I leapt to the chance to get as much help as I could. I understand that not as many people have that confidence, and it's really unfortunate, because that's what it takes. It takes confidence. So I think it's been positive for me to understand myself, and I hope other people can do that too. But yeah, just participating in the support that I know I needed.
Yeah, And I think that is a massive point. It is about meeting the individual where they are. Thank you. Taylor, what's been the biggest positive difference that has happened in your mental health experience?
I think for me, it's just been starting to talk and actually opening up about things. I really suffered with like these suicidal thoughts for probably 2 or 3 years before I told anyone. And I think I'd have to say, like, actually starting to talk to someone, whether it's my friends or whether it's my partner or like a counsellor, like that was the change. And although I've had some dips and stuff since, I think I'd be in a much worse place if I've never spoke.
Yeah, 100%. I am very much there with you. And Annie, finally, what is your greatest positive difference that has happened in your mental health journey?
And it's so hard to sort of pinpoint one because, yeah, thankfully there have been lots of moments of sort of hope. But I think sort of sharing my story with Batia and the kind of warmth and understanding I was met there when I did this workshop was really, yeah, really positive. I also had a really positive experience, sort of through a uni service, but not entirely. And this was after there was too long of a wait list to kind of go to UTS counselling. I shouldn't be naming the unis, but yeah, there was too long in terms of the uni counselling, and that's, I will say that's a common problem. Wait lists are a thing, and it's great that there are so many people accessing the service, and they just didn't have enough space at that time. And so I ended up going to a psychology clinic. It was part of the university, and it involved speaking to a provisional psychologist. And what was really great and positive about this was that it was just an incredible relationship that I had with the psychologist who I was paired with, and it was incredibly affordable. So there were just a whole lot of things about that that made it easy to kind of feel supported, and yeah, that for me, finding that resource that was like, you know, cost about $12.50 as a student, and having someone that was not yet fully qualified but just really, really incredible was, yeah, so uplifting.
That's amazing. Thank you so much, Annie. I'm not sure about you, Zoe, but, well, actually, I'm probably sure. It has been amazing being a part of this incredible panel, and such a vulnerable panel this evening. If you've got anything else to say, Zoe, if you don't, I might throw over to Jo to wrap us up.
Can I just say one giant, big thank you to everyone here on the panel. I know everyone was really excited, and you know, we don't really get this opportunity that often or at all, I don't know, but hopefully the conversation will continue. I don't know how that's going to look like yet, but we've had a lot of questions as well during this webinar, so it shows that a lot of people are engaged and they do want to listen, which is also an amazing thing. Over to you, Jo.
Thank you. And the words are, you're absolutely right. There were so many questions that we just couldn't get to. Our panelists are super awesome and are happy to try and stay online and try and answer a few of them now if we can. But if not, I think we do get the transcripts and we can try our best to try and answer them post the event. Just a couple of bits and pieces from me. First of all, I want to really acknowledge another young woman, Taylor, who was supposed to join us this evening, a young First Nations woman, and unfortunately wasn't able to join us at the last minute. So sorry that she wasn't able to join us, but hopefully we'll be able to, you know, represent those views in a different way. I'm acknowledging my dog who's come to join me this evening, perhaps to tell me that dinner's almost ready. But actually, I want to thank you all for joining us this evening and spending your evening with us, as Ian said. But most of all, I want to thank our panelists, and I'm sure I'm speaking for all of our viewers as well, to say thank you so much for your amazing contributions this evening. It's been an absolute privilege and an inspiration to be part of this conversation and just to sit back and listen to you all. And we really do hope this is the beginning, just very much the start of an ongoing conversation. If other people would like to share their experiences of mental health during the COVID-19 pandemic with us, we do have a survey that's live at the moment, and I think Grace might be posting the link for us now. And I'll now hand over to Ian to wrap up for us. Thanks again, everybody.
Thank you.
Thanks, Joe. Thanks to our panelists. We wouldn't be able to do this work without particular support. This Central National Health and Medical Research Council Centre of Research Excellence, Youth E, that we have is critical. And I must say, the voices that you've heard this evening are some of many. One of the really big challenges that Joe and I face is that in the worlds we exist, there just aren't enough young voices at the table. Not just around mental health services, but around the really hard topic of suicidality. And so to have people share their experiences this evening, to see that within context, is absolutely critical to driving societal change and improvement in services. And it's really good for people like me to spend a whole hour saying nothing and actually have that replaced by others. I think somebody else said how intimidating it is to sit with a whole bunch of 40, 50, dare I say, myself, 60-year-olds and up. I see Professor McGorry. We're a bit intimidated when we're surrounded by a whole lot of people under the age of 30, 20 and otherwise, a lot. But it is the absence of those voices. I think Joe and I have spent a lot of time just in the last month saying that in suicide prevention in Australia, the voices of young people are not adequately represented. We live in really tough times, and we'll have further data out tomorrow as part of national surveying and national modelling in response to the COVID-19 crisis. These are really tough times for young people. The disruption to employment, to education, to social developments, to relationships, to normal ways of coping together, to building one's identity into the future are really challenged. So, you know, at this point in our collective history, there is not a more important point than for the voices of young people to be heard. We are grateful to have available these types of technologies and services and this participation in the voices that you've heard this evening. It is a process we aim to continue. We've been very lucky, not just through the NHMRC, but through our organisations, the University of Sydney and the University of Melbourne, through Origin and Brain and Mind Centre, but also others, the Bupa Health Foundation, Future Generation Global in particular, and others who support this work for supporting particularly the voices of young people, the voices of their families. I might say as a father and grandfather, there is some family stuff that actually needs to get into all of this, and the support of families to participate in this area is actually families who've been affected, who are one of our largest supporters on an ongoing basis. If we are to ever change the community discourse to make mental health dealt with as in a simple and straightforward way and with the same degree of respect as other physical health problems, and justify the degree of national investment we'd like to see, it is critical that we rely on all of you to do this. So very much thank you to all those who've been involved. I think a slide's going to pop up in terms of further resources and further places for further information. Please be in contact with us. Sam and Zoe and others who've seen here this evening are desperate to have a lot of other voices.
Yes, please.
Yes. I want to say, well, I have a long list of failings in my life, which are long and multiple if anyone's got another hour to spare, but one of which is, in much of the work that I've been involved, the actual voice of people, and particularly young people, has not translated into the structural changes in the organisations in which we work. And so this Youth E initiative that we are part of isn't just about the academia, the results, the trials, the evidence. It is about building a community that can discuss youth suicide specifically on an ongoing basis and be treated very seriously. We're very lucky at the moment that Christine Morgan, the head of the National Mental Health Commission and the Prime Minister's principal advisor on suicide prevention, has prioritised the voice of lived experience. We need to make sure that she prioritises the voice of youth experience within that wider setting. Hopefully tonight is part of that ongoing service. Thank you so much for your participation. And over 200 of you have set out the whole hour and are still here. And many others who may not have been able to join us, hopefully you can pick up the recordings of this seminar. Thank you so much and good evening.